you, Mr. Speaker, and I'm very, very pleased to rise and speak to Bill C-442 and act respecting the National Lyme Disease Strategy at this second reading stage. Again, I would like to acknowledge the work of my colleague from Saanich Gulf Islands for bringing forth this very important initiative. And I want to say from the very outset, Mr. Speaker, that the official opposition will be voting in favour of this bill. I want to acknowledge as well the pioneering work of former MP Judy Wasylycia-Leis, who well over 5 years ago, Mr. Speaker, urged the Health Minister to implement such a strategy. Our NDP health critic from Vancouver East has also written to the Minister of Health about this issue and pushed very hard to establish a national strategy to diagnose, treat, and do better surveillance for Lyme disease in response to the growing threat of infection from coast to coast. Both she and I have seconded this important bill. Receiving early and appropriate treatment would improve the quality of life for thousands of Canadians and their families. Lyme disease is one of the fastest-growing infectious diseases in North America. I have heard firsthand about its devastating effect from a constituent, Nicole Bottles, who is a 20-year-old sufferer of Lyme disease. She's now in a wheelchair, Mr. Speaker, and met with me in Ottawa to advocate for this national strategy bill. Early treatment of Lyme disease reduces the severity and duration of the illness. Experts agree. More accurate testing and earlier treatment of Lyme disease would reduce the healthcare costs associated with a lengthy illness and the more severe side effects, particularly for women who suffer longer-lasting effects when their Lyme disease goes untreated. As you know, Mr. Speaker, Lyme disease is caused by a specific bacterium spread through tick bites. It is one of the most underdiagnosed diseases in Canada. However, Lyme disease symptoms can range from a localized rash to fatigue to very serious central nervous system disorders that can lead to paralysis. So let me begin by outlining the nature of the disease, then talk about what Bill C-442 is intended to do to address the problem. Last month, the newspaper in my community, the Victoria Times Colonist, reported that a Vancouver Island hawk became the first raptor to join the list of species believed to spread Lyme disease. Research scientist John Scott found a Cooper's hawk with 22 ticks on it, 4 of which were infected with the bacterium that causes Lyme disease. It's the first raptor or bird of prey known to host this bacteria. The Cooper's hawk was found on the doorstep of a house in Oak Bay, part of my constituency. It flew into a window. Then it was delivered to the Wild Animal Rehabilitation Centre near Victoria, where it was examined. 5 of the 6 species of ticks that live on Vancouver Island are apparently involved in the transmission of Lyme disease. Other known reservoir species hosts include songbirds, deer, mice, and rabbits. And I would agree with my honourable friend opposite from South Shore St. Margaret's that deer have become an increasing part of the problem, and in communities such as Oak Bay, with the rapid increase of deer population, this only can cause additional concern about the spread of this devastating disease. Because the ticks feed on the blood of animals and humans and pass on Lyme disease when they feed on these species, mice, birds, and the like, and then they carry the bacteria that bites humans and the disease cycle begins. Ticks are most common during the warmer months. So Canadians who live in areas of our country with mild winter temperatures and minimal snowfall, such as in southern Vancouver Island, have an increased risk of coming into contact with ticks. But as Bill C-442 notes in its preamble, climate change is one of the factors that is causing more and more regions of Canada to be at risk, as we have experiencing more warmer weather ahead of us, and that would only increase the tick distribution across the country, as the scientists have predicted. So by 2009, Canadian physicians were required to report on cases of Lyme disease through their provincial health registries. However, Mr. Speaker, According to the CBC News last year, national statistics are still unavailable at this time. Recently, as the Honourable Member for Saanich Gulf Island mentioned, the U.S. Centre for Disease Control and Prevention estimated the number of people in the United States affected by Lyme disease was around 300,000, but that figure is 10 times higher than what is reported to that agency. In the province of New Brunswick, in 2009, there were 128 confirmed cases of Lyme disease, but by 2011, that number had doubled to 258. Lyme disease, if treated at early stages with antibiotics and the removal of the tick, can avoid the severe neurological symptoms that often occur. I'm told that in some states, like in the United States, such as Massachusetts, it's relatively routine for the tick to be removed and antibiotics administered at that early stage. However, there seems to be a different level of awareness in Canada, hence the need for the strategy before us. Unfortunately, there doesn't seem to be any standardized testing for Lyme disease in Canada. So Lyme disease advocates and health practitioners say that different types of blood tests performed to identify Lyme disease currently yield inaccurate results. What does that mean? It means that patients who in fact have Lyme disease are often not diagnosed or are misdiagnosed with such illnesses as multiple sclerosis or chronic fatigue syndrome. They don't receive the appropriate treatment, thereby exacerbating the symptoms. I've spoken with some patients from Victoria who say that they've had to travel to other countries, as the member opposite from Sault Ste. Marie has also acknowledged, possibly because the treatment in Canada ranges so dramatically and is often inadequate. What would Bill C-442 do then? Well, first it would track the incidence rates, create educational materials to raise awareness about Lyme disease, and establish testing and treatment guidelines, as well as track the related economic impacts of Lyme disease. Second, Bill C-442 would support research and implementation of better and more reliable diagnostic testing, as well as increased education and awareness among physicians. In short, Mr. Speaker, the bill would create a coordinated strategy, which is long overdue. Canadians deserve to get adequate testing and treatment for this disease. The federal government is responsible for improving the surveillance of Lyme disease, as well as establishing best practices, so the province can better understand the disease and adopt evidence-based measures to improve outcomes. Now, the Canadian Lyme Disease Foundation, or CanLyme, is in full support of Bill C-442. President Wilson stated as follows: "This bill responds to the failure of existing guidelines to reliably detect and treat Lyme disease," close quote. As the member for Saanich Gulf Islands already noted, the College of Family Physicians in Canada has also supported Bill C-442. It stated as follows, I quote, "The College supports further studying the economic and health impact of Lyme disease to ensure Canadian physicians have the necessary tools and knowledge at their disposal," close quote. Mr. Speaker, I regret that in past governments have failed to take the appropriate leadership role on a range of important health issues, including the kind of coordination that is necessary and funding necessary for health innovations, testing, and treatment. It's only in 2009 that we began to track Lyme disease, and some have argued in my office that there's been a failure to heed the pleas to advance testing and treatment options in this country. So this is an issue where the federal government must show leadership in health care and work to better protect and support the health of Canadians. But, Mr. Speaker, I think this is far from a partisan issue. It doesn't help at all to talk about past governments. We want to stand firm with the Honourable Member for Saanich Gulf Island and all members of this House to address this problem. The time to act is now. Sufferers from Lyme disease are looking to this government for leadership. The official opposition wants to be part of that solution. It's time to get on with it. We will be voting in support of this bill. Thank you, Mr. Speaker.